Welcome back to The Blend. Time is running out to make changes to your Medicare coverage plan. But if you have questions, our next guest can help you make the best decisions possible. Dr. Tracy Wakefield, Medical Director of Healthcare Partners Medical Group, joins us now. It's great having you back.
Nice to be back.
Monday's the cutoff day. We've been talking about it for a bit now, but open enrollment ends on Monday.
Correct.
This is big.
Yes, every year between October 15th and December 7th, it's the one time seniors have the ability to change their Medicare plan, and so it's really important because this change will affect them the entire following year. So it's time to re-examine that.
It's certainly important. Why is it so important to review your plan? Because people, they might think, oh, well, I've picked my plan maybe 2-3 years ago. I'm good.
Well, every year a lot of the plans change, and it's important to reevaluate what your individual needs are and make sure that that plan is still going to meet them. So at Healthcare Partners, we encourage all of our patients to really re-examine the plans at this time before they choose that plan going into 2016.
Well, chances are maybe you're taking different medicine than you were 2, 3, 4 years ago, and certain medicines are covered, or maybe a certain doctor that you're going to is no longer covered with one plan than another. You have to keep your eye on it.
Correct. There's a lot of reasons to look because a lot of things change over the years, and the new year may be completely different than the last year. There's about 4 areas that we want patients to really pay attention to. One is, what providers does that plan allow you access to? Second, what kind of changes in the cost can you expect, particularly the out-of-pocket expense for yourself. And also you have to think about the drug plan that comes with your plan. So it's a really important time to look at your individual situation based on those 4 things and choose the plan that's right for you. It
has all the joys of tax time, but this actually will affect your health going forward. You need to pay close attention.
Absolutely.
Let's talk about Healthcare Partners Medical Group and what you're able to offer, not just everybody, but especially the senior community. I mean, they end up seeing the doctor more often. Want to make sure they get the best care possible.
Right. At Healthcare Partners Medical Group, we offer what's called the total care model, which is really a value-based approach to medical care. It allows patients more access to coordinated care, which includes primary care, specialists, and a whole group of professional staff, really enabling the patient to make more out of their health care. And help them coordinate all the different areas besides just the traditional medical part, also giving them more access to their care.
Of course. Well, I mean, you generally have your general practitioner, and then you might have another, specialist. They have no idea who each other are. They have to fax stuff and all that stuff. You guys have it all in one computer system, and you don't have to worry about retesting over and over.
Right. Coordination is very important, especially as we get older and you get your care gets more complicated. So at Healthcare Partners with the total care model, we take that into account, and we have not only the physicians, but the specialists and also a whole professional staff designed to coordinate that care better.
I mean, just to think, when you enter a specialist place that you might be in the first time that's within Healthcare Partners, you don't have to answer that 15-page questionnaire because it's already there.
Correct. It makes it a lot simpler for everyone.
That alone is worth the price of admission. And by the way, how much does it cost to be part of the total care model extra?
It costs nothing extra.
Why?
It's part of what we deliver every day.
It's a beautiful thing. The deadline's approaching. There's still people that are probably a little perplexed. I know how I get when it comes to tax time and how I'll probably get when it comes to this. Where do people go for answers?
Well, any member of our staff in our offices can answer questions about Medicare Open Enrollment. Also, 24 hours a day, there's a number you can call and talk to people who are also educated on the benefits. But you can also go to www.choosehcp.com and get more information about Medicare Open Enrollment.
And once you see that Healthcare Partners logo, you start to see it everywhere you drive around the valley. You have a lot of locations here.
Correct. We have grown quite big. We have over 40 primary care offices are owned. Not to include we have specialist office, we have pediatrics, cardiology, oncology. So yeah, you'll see us pretty much everywhere nowadays.
It's pretty awesome. All right. So if you want more information, choosehcp.com.
Correct.
All right. It's great having you. Tracy, thank you so much.
Nice to be here.
All right. Remember, Medicare Open Enrollment, this is legit. The period ends this Monday. You need to make your changes to your plans and coverage. Now is the time. There's no other time than now. Find out more about Healthcare Partners. Just go to the number or website you see right there on your screen. They're also on Facebook and Twitter. Get it done. All right. Summerlin Hospital, they are hosting a job fair.